First of all, I am thanking for the IPH leaders who permitted me to present this class. Actually, my topic is not emergency medicine homeopathy, but my intention is to prepare the community for using homeopathy in emergency conditions. We can use homeopathy in emergency condition for one or three items. That's only I'm mentioning here. IFPH mission is to, first one is to promote and propagate homeopathy as an integrated, comprehensive medical system of the world. Second, to ensure indiscriminate availability, accessibility, and introduction of homeopathy to the citizens of all countries. Third, to provide homeopathic support to the general public and equip them with the system. I'm focusing on this three mission only. From this, I am presenting my paper. When somebody is having fever, they mostly take a paracetamol. Globally, everyone is doing this. Why? Everybody is so far familiar with paracetamol. Everyone believes that it is the best way to manage fever. Previously, our grandmothers gave rice porridge, honey and chutta papadam. The ordinary fever was managed with it. I said this because the allopathic community created a strong belief among the public that paracetamol is for fever. But even the authorized textbooks are against it. The authorized textbook says that do not give antipyretics for fever. For immediate, if any danger is there, you can use it. Otherwise, don't give antipyretics to fever. That's all the books. The practice of medicine, internal medicine, and pathology. Boyd pathology, news pathology, in every textbook, it is stated that. In our daily practice, we are met with many wonderful actions of homeopathy. Some of them are occurring once in a while, but most of us are observing again and again that some medicines have its action in some particular emergency situations. We have to trace out such incidents, and if it is the experience of many homeopaths, we can confirm it and can declare it before the public as the indicated homeopathic medicine in some emergency problem. By publishing it widely, people may benefit from it, and a new flow from public may come for homeopathy consultation. We have to cultivate homeopathy from a grassroots level, or we have to promote it. Along with COVID-19, homeopathy became more popular in the world. It's a fact that IFPH takes a very good role in that. Actually, Ashsalb 30 become the star, not homeopathy. It is a fact that Ashsalb is introduced as an immunobooster instead of COVID preventive. But now, people know that it is a good preventive medicine against viral diseases. So in future, Ashsalb may be used by them in viral epidemic disease without our recommendation. It will be appreciated. Now, let us think what additional properties are to be introduced to public regarding Ashsalb. Ashsalb is utilized in many allergic conditions, but is not the point to be discussed here. We have to introduce its effect on some emergency situations. We must inform the public that It is a useful remedy for termite poison. In food poisoning cases, many deaths occur. People are rushing to hospital. Meanwhile, many deaths are occurring. But using ash salve after this poisoning, it helps a lot. Second one, it is also a very useful one in burns from fluid. Some of the members know the fact that yesterday I had an accident. In the evening, I feel hungry and take an egg, that egg from the fridge. Actually, it's boiled, hard-boiled egg. But it was so cold. So I put it in the microwave oven just for 1 minute and take it out. It appears not so hot. It's just warm only. I took it and I dip it in the salt and pepper and just make a bite. Suddenly, the egg exploded like a bomb. My lips were burned. Severe burn occurred in my lips, and I got in a shock. The egg, parts of the egg spread in all in the room. You can see some video from YouTube that how this egg exploded after cooking. So suddenly, I took ash salve 30 from a kit. I took 4 pills. And today, now I am all right. Just small blisters are there, but it is not hindering me to speak. That's the wonder of homeopathy, and it's a God's grace. The homeopathy act like that. After taking ash salve, still I am not in a mood to act like I saw by video phone. My daughter, who is a doctor, she advised me to take aconite also because I am in shock. I said that it's now 2 hours past. There is no need of aconite. But she said, you just take it. And I took aconite. Immediately, my shock went away. I become active. Then I joined this IFPH meeting half hour late yesterday. And yesterday, you see that I was lying in bed. That's the condition yesterday. Now I am all right. That is the wonder of homeopathy. If we publish the effect of ash salve like this, the ash salve should be kept in houses and utilized as a first aid. I remember a 3-day conference of Kerala Gazette Officers Association conducted in Thiruvananthapuram during late 90s. There were 2,000 delegates participating from different departments and various areas from Kerala. In every delegate's kit, there is an item as a bottle of Nux Vomica 200 pills labeled as 4 pills for gastric derangements. It was a gift from doctors of homeopathy department. Many of the delegates tried it out and got relief from for their ailments. After that, a large number of government officers and their families turned to homeopathy as their first line of treatment. Another incident was during 2000 and 2010, every year, an Arogya Mela was conducted for a week in every taluk headquarters in Kerala. Actually, it is conducted like a health festival. All the health departments assembled there for conducting medical camps, seminar, etc. for public. Homeopathy department provide a home remedy kit along with other IEC materials. In Ayurvedic pavilion, there's a heavy crowd for getting some Arishta, mosquito repellent powder, etc. Similar crowd also created in homeopathic pavilion for grabbing the home remedy kit. Even the district collector had given a recommendation letter to give home remedy kit for their officers. Some week after the Mela, many police officers approached the government homeopathic dispensaries for refilling the empty bottles from their kit. They claim that it is very useful for their health issues when they are posted in some remote areas. The outcome was that many police officers and their families turned to homeopathy as their first choice. This home remedy kit was an idea of Dr. Prasanna Chandran, who was the managing director of HomeCo. I think Dr. Prasanna Chandran is attending this webinar and he will speak something regarding this. In my personal experience also, I noted that this home remedy kit, which was made by HomeCo Kerala, is very useful to spread the effectiveness of homeopathy in public. If we give one kit for a family, at least one among them may benefit from any of the medicine. When I was working for government department, in a geriatric project, I had given out 1,500 home remedy kits. Most of the doctors were against this, as they thought that this would create new quacks. But the outcome was different. Some of the people used it and found that it is very effective. Then they turned up for homeopathy consultation for treatment of other ailments. Even some techies from their family inquired about it, and some of them got cured of their chronic gastric problem with the medicine Exhomica. So they shared about this home remedy kit through the social media to their friends. I am not recommending the home remedy kit. We can think about it later after thorough discussion. Some days back, while attending Dr. Alex Kurian's presentation, I noted that he is giving a family medicine kit to manage his NRE patients over telephone. We must discuss and confirm which are the medicines to be included in that kit. It will be useful to all doctors to manage their patients' immediate needs online. We can label it in our name, IFPH, and ask the pharmaceutical companies to market it. In certain countries, some homeopathic medicines are not permitted because its name resembles poison. Such medicines can be labeled with some code name. I am not proposing this for the, I am proposing this for the second phase only, not for now. This idea. Now, it is easy to introduce few medicines at the first phase for the public as a lifesaver. Ashsal 30 is already a non-medicine to the world as a preventive for viral epidemics. We have to give additional information that it also having those extra properties. We can promote another medicine called Arnica. It's an effective medicine for injuries, accidents, etc. as an emergency medicine. Before rushing to the hospital, some may try this and find its wonderful action. Every homeopath are aware of the effect of arnica in accidents. It helps a great for pain management as well as to control bleeding. Another point to be noted is that even in allopathic hospitals, the recovery period is shortened for those who used arnica after injury before the hospital admission. There are many other medicines for ailments of injury. That is the doctor's choice. Only arnica is to be introduced to the public. Like that, many homeopaths had noticed the effect of aconite nap for managing the shock. I remember an incident that took place when we were posted for a medical aid camp alongside allopaths in a pavilion of the stadium for the state level school sports meet. We attended many injuries problem of the sports participants. On the final day, a portion of the pavilion collapsed and fell over the crowd of spectators. Many casualties were taken to our camp, and we gave aconite as the first aid. In that camp, I myself and Dr. Shibuchari, who is senior to me, he is the camp officer. We are there to attend these cases. First we give aconite. If they had any injuries, we would have administered the appropriate medicine. The suspected cases of fracture were referred to the allopaths in our camp itself. But they did not give any medicine. They immediately transferred the cases to the district hospital because they don't have any medicine like our aconite. Later, the surgeon from the allopathic side in the pavilion accepted the fact that you have a wonderful medicine for managing shock where they don't have. Actually, he was observing our management of casualty during that time. You see this picture? A big elephant is tied in a small pole. Elephant is not aware of his strength. There is an old proverb that like this. If it knows its strength, the thing may go in a different direction. So we must be aware of our strength and utilize it for the benefit of the humankind. Moreover, the first and the best remedy to prevent major ailment like CVA, that is stroke, heart attack, etc., Ashtal is the best medicine. It is the remedy which can be given before the commencement of severe symptoms. It is important to know the term first. The symptoms from face, arms, speech, and the time management. Let us discuss it later. Now, the people are aware of such ailments. And if somebody had any suspicion of stroke, ask the patient for a smile. If he smiled properly, then nothing. But some disfigurement in face scene, that is the suspected case of stroke, and immediately that's bad. And ask the second one is raise the both arms simultaneously upside. If the patient cannot lift one arm, there's a chance for stroke. Third one, ask them to answer some simple questions. The name, like that, some simple letters, or ask to count 1, 2, 3, 4. If he feels any difficulty in counting, the That indicates the chances of stroke.
Hello, in this health sketch, we want to talk to you about stroke.
Actually,
It's a bit of an
this is
stroke. It certainly has
taken from YouTube.
Strokes, swimming strokes, or brush strokes. The word stroke comes from the idea of receiving a strike or blow, as that is how quickly strokes appear. All of a sudden, people are struck by this illness. Did you know that every year 50 million people worldwide have a stroke? Of these, 5 million die and another 5 million are left disabled. Whilst most strokes occur in people over the age of 65, they can occur in much younger people too. But what exactly is a stroke? The brain, like all parts of the body, needs oxygen, which it gets from the blood. A stroke happens when blood flow to the brain is cut off. When brain cells are starved of oxygen, they become damaged, and the symptoms that follow are called a stroke. As the brain controls the whole body, the symptoms of a stroke can be wide-ranging, depending on which parts of the brain are affected. If the stroke occurs here, it would cause a drooping face. Here, weakness in the arms or legs. Or here, difficulty speaking. Other symptoms can happen too, like changes to vision, loss of balance, confusion, and memory loss. The effects might be fairly noticeable, but are more often severe and disabling. Sometimes these changes can be reversed if treatment is started early. That's why it is so important to act quickly if you suspect a stroke. Remember, you need to get help fast. F is for face. Is their face drooping on one side? Can they smile? A is for arms. Is there weakness in the arms? Can they lift them both up? S is for speech. Is their speech slurred? T is for time. If you spot any one of these signs, then it's time to call an ambulance. Once the ambulance arrives at the hospital, a doctor will assess you and arrange an urgent scan of the head, which shows where the brain is damaged and what type of stroke has happened. Strokes are put into two groups depending on the problem in the blood vessels supplying the brain. There can either be a blockage, called an ischemic stroke, or a bleed, called a hemorrhagic stroke. The majority of strokes are blockages. It's important to identify early on which sort of stroke has happened, as they each have very different treatments. Blockage strokes are commonly caused by the buildup of fatty material in blood vessels. This fatty buildup may lead to a clot, which blocks the blood supply, just like in a heart attack. This is why a stroke can be thought of as a brain attack. A clot may occur within the brain, or it can travel from another part of the body, commonly the blood vessels in the neck. Clots can also travel from the heart, which may happen when you have an irregular heartbeat called atrial fibrillation, or AF. If a blockage stroke is detected within the first few hours, a clot-busting medication is sometimes given to dissolve the clot. This is called thrombolysis. If thrombolysis can't be used, other medications such as aspirin will be given as treatment instead. Bleeding strokes happen when a blood vessel bursts suddenly, causing blood to leak in or around the brain. In these strokes, blood on the brain can lead to swelling, a serious problem which may require surgery in some cases. Sometimes, stroke symptoms completely disappear in less than 24 hours. This is called a mini-stroke, or TIA. Often, symptoms only last a few minutes, but just like with a full-blown stroke, you must go to hospital immediately if you suspect a TIA. This is because a TIA is a warning sign that you're at high risk.
You see this animation. The modern medicine people are giving such information and ask them to rush to the specialty centers within the golden hour. Many lives are saved from this information. Actually, I try to make such an animation for this presentation, but I did not get it in time. That's why I put this from this YouTube. You can see many YouTube videos like that. The golden hour is 1.5. Within 1.5 hours, we had to admit the patient in a specialty center. But many people are unable to reach such a center in the golden hour. So, in a state like in a country like India, there's no hospital nearby. Some persons cannot reach the hospital within 24 hours. So, ours may be a novel idea to stock and give 1 dose of aconite nap 30 as a lifesaver before rushing to the hospital. There are many indications for aconite. This knowledge can be kept with the homeopaths. Only one life-saving indication is spreading publicly. Ask them to take 1 dose of aconite nap 30 when someone shows the symptoms of stroke. We had to make such animation, 1 minute animation or 15 seconds animations are necessary for this. While I was working in a remote village in Andhra Pradesh, I have treated many snake bite cases successfully. Even the fatal cobra bites were treated within hours. Ictericia tincture was the main medicine used. Naja 200 used in terminal conditions. I think the Manu and Dr. Jacob Thomas, who are participating in this webinar, they are also worked in in that field. But I am not recommending it in our kit because it is not the experience of majority doctors. But I am advising my patients to stock Ictericia tincture in their home as a lifesaver medicine. But in IHFP platform, it is the many doctors experience is needed for selecting such a medicine. First of all, some few medicines should be introduced to the public widely. We had to propagate it through all media with the help of short films or cartoon pictures. When we propagate this idea through the medicine dispensing cover by printing this message on one side, we are giving medicine in a TT cover, big TT cover. In a big cover, if we from main side, we can print our institution's name, instruction for patient, etc., like that. But on the opposite, reverse side, we can print this message, and this is an easy way to spread this message to public. Moreover, the patient will approach the doctor after this. After the admission of hospital, then they get some after discharging, they will approach the homeopathic doctor who gave this cover. In Kerala, it is easy. It is an easy task to give such medicines in every home. Through Panchayat project, we can distribute in every houses. All the medical officers should be aware of it, and all the medical officers must have a positive attitude regarding this. I remember that during my service in the department, one of my colleagues, Dr. Shibucharian, I stated earlier, gave a proposal like this to the director. And the director rejected it because of lacking fund. But now, abundant fund is there in Panchayat. I trust due consideration must be given to these ideas and suggestions that I have proposed to raise the flag a bit more for the people to see and decide themselves for immediate relief, cost effectiveness, and moreover, a trust and support of homeopathy. Thank you all for your support in listening and appreciate your patience and let us move forward in full faith to achieve our goal. Thank you all. Now, thank you all. Thank you, the leaders of IFPH for granting this time for me, the valuable time for me. Thank you all.
Thank you very much, Dr. Abraham Vaidhyan. That was an excellent presentation. And we all enjoyed your beautiful slides. And it is associated with the YouTube video. All are nicely presented. Your idea is also an excellent. I think we will be able to consider in our steering committee after our registration process is over to seriously discuss this matter, and I hope we will be doing that. Thank you for bringing this great idea, and it is in line with the purpose and mission of International Forum for Promoting Homeopathy. And as you all know, Dr. Abraham Vaidhyan is a very intelligent and experienced practitioner. Those who wish to ask questions, please raise your hands and we will be calling you from the order of raising hands. Please go to the participant list and there is a raise hand option. If you are, Dr. Manoj.
Yes. Good morning, good afternoon, good evening, everyone. Thank you for inviting me and giving me an opportunity to participate in discussion. So it's a nice presentation, Doctor. And I think there is a rubric, ideas crowding in mind. That is the situation, I think. A lot of ideas. Probably of ideas are there. It's a good one. And the suggestions are very nice one. And we must consider this, what is the home remedy kit. It's a wonderful idea. And everyone should try that. A good one. Then about the different medicines you have suggested is very nice one. And especially the arsenic album. There is no medicine equal to arsenic album, in fact, in the medical history, I think. A medicine for the last 220 years is used again and again without any side effects or no problem, but still is encouraged. A wonderful medicine for arsenic album. Then the Nexomica. I think for the indigestion case, we must first consider Pulsatilla, because Hahnemann suggested that Pulsatilla is the first one medicine. There is some indigestion problem. Then this indigestion is associated with erectation. She suggests standing root. It's not suggested Nexomica. I think that's then another medicine is that coffee. And in some cases, there's a paralytic condition of the stomach. He advises to take root coffee when there is no medicines are available. Then the use of arnica definitely is a good suggestion. Everybody should have the stock of arnica, Rustox, and Ledambol, Calendula. So many medicines are there. It's because everyone knows that the quality of our medicine is not compared to any medicine, because of the mode of preparation, based on the German technology. We must add that because of the technology we adopt simple medicines, very safe one. And anyway, good presentation, Doctor. So you must participate in our discussions and programs so that the crowded ideas can be shared for the betterment of the community. Thank you for Doctor. Thank you for giving me an opportunity. Thank you.
Thank you.
Thank you. Thank you, Dr. Manoj. And now I invite Dr. Hubert.
Oh, thank you very much, Doctor. We pray for today, your health, and yesterday's bomb blasting. God saved you from all calamity.
Keep the microphone little away from your mouth, Dr. Hubert. Yeah, it is.
Can you hear me? Cannot.
There is little disturbance.
Yeah.
Disturbance.
Yeah.
Now,
there is some roughness in your voice, or I think because of the microphone too close to your mouth.
No, I don't think that.
is it okay? Now okay?
No. Some disturbance is still there. No.
Okay, some disturbance is there. We don't know what it is. Okay.
What to do?
Okay, continue. Don't worry. You ask your question. Yeah.
Maybe due to my laptop, the camera and mic are not in a good quality. If I present it through my phone, you can get a better sound. The problem may be with my laptop.
No. It is not from you, Dr. Abraham Vaidhyan. It is from Dr. Hubert.
Okay. Okay, thank you, sir. Thank you, sir. I will.
Yeah, your voice was okay, no problem. It's only from Dr. Hubert there is slighter roughness. Dr. Hubert? Okay, I will move to Dr. Velapan Pillai. Mr. Velapan Pillai. Mr. Velapan Pillai, we will come back to Dr. Hubert later. Yes.
Okay, thank you, doctor. Thank you very much, Vaidhyan doctor. Thank you very much for the nice presentation. I am not a doctor, but I am a lover of homeopathy. It is very useful for the common man also. Whatever you have suggested is very, very novel, because for the promotion of homeopathy, the people should be knowing about the effectiveness. As you have compared to the power of event, homeopathy is also good example set. Thank you, doctor. I suggest that we can utilize the service of Kudumbasri unit of ladies. They are the in our aerial days. Our grandmothers were the doctors of the house. I guess the Kudumbasri women will be helpful for promoting homeopathy if we give a true home kit for the common diseases, especially for the children, for common cold or cough, like that. You know better than me. I may suggest that we may think of organ transplantation. So we can give medicine also. As you suggested that heart attack also is a common disease nowadays. So with the proper simple way of instructions, we can popularize this kit. Thank you, doctor. Thank you very much for the knowledge. We expect more from you, sir. Thank you very much. Thank the organizers for inviting us. Thank you all. Bye.
Dr. Abraham Vaidhyan, please come. I think somebody is using mobile and laptop together. One need to be muted.
Oh, it's muted, doctor.
Yeah. You can mute, unmute from your side, doctor.
Okay.
Yes, sir. There are many medicines to be used in as an emergency medicines. But first of all, we have to focus 2 or 3 medicines. If they work successfully, more people may come to homeopathy. And the second phase, we can make a family kit or home remedy kit with 15 or 20 medicines to cover all the purpose. But the early suggestion, the female remedy, that's an important thing. In my practice, I noted that for dysmenorrhea, most of us are using colocynth tincture. By giving 20 or 30 drops of tincture, we will not get any effect. But if we take 1 drop of colocynth tincture in 1 liter of water and stir it and take 1 spoon each within 2 or 3 hours, the pain will subside. That's a sure indication. Dose is important. In tincture, colocynth not needed 10 or 20 drops. It needed only 1 drop in 1 liter of water. That is the effective dose. Like that, we can suggest some medicine for female complaints also. Most of all of us are very brilliant in prescription, and all of us having experience in that. So we can discuss it and take 3 or 5 medicines for propagate in the first phase. That's all.
Okay, thank you, Dr. Mr. Parit Babakan.
Hello, Dr.
Yes.
Vaidhyan. Good evening, sir.
Good evening.
I am not a homeopath, the homeopathy lover. Anyhow, I feel my honor and privilege to appreciate your fine presentation, exhibiting your intellectual honesty. Exactly. And congratulations to you, sir. You spelled out some very important remedy measures available with homeopath in emergency situations, and also mentioned about arnica, arsenic alba, aconites, etc. In a that is very appreciated. Will appreciate it. Some of our doctors are reluctant to mention the names of the medicine in homeopathy. The idea of home kits is excellent. Actually, if we put into practice, that's an excellent idea. No doubt about that. Concentrations of homeopathic measures, as you've mentioned, is seen to be very significant, and that we should translate into action. I think our forum will see this suggestion seriously and try to translate into practice. Thank you very much. All the best. Fine.
Okay, thank you, Mr. Parit Bhavak. And now, Badran, doctor. Badran, sir, please.
Good evening.
Oh, you muted again, sir. Okay, now, yeah, now you are you can unmute from your side. Oh. You lowered your hand, so I will go back to Dr. I go to Dr. Danesh. Dr. Danesh, please.
No, not lowered.
Okay, okay. Okay, then continue, sir.
Dr. Abraham Vaidhyan and me with Venugopal and Shaji, everyone of us were students in first batch of grad BHMS. And we are very close friends and could work in the Department of Homeopathy also together. In my opinion, while he was a superintendent government homeo hospital Trivandrum, there were medicine kits available from HOMCO. Some near about 100 kits received and were issued to demanding people. I think more than 20 medicines were there in every kit. That emergency medicines are included in that kit. I doesn't know that that kit is available now. It would have been better if the kit is introduced again. It can do very good. We can, after giving kits, we can give our phone number, and the patients will usually ask which medicine is to be given for this condition. And after enduring all the relevant data submitted by the patient, we can prescribe the medicine and they will get rid of that illness at once. Then, but this issue of kits should be commenced again. I think everybody will try their best to issue the same again. That's all. Thank you.
Thank you, sir. Dr. Abraham Vaidhyan, any comments from your side? Okay, so next I go to
I failed to hear some comments because my earphone is missing and I cannot hear it from my laptop. That's I didn't heard some comments.
Oh, so you're unable to hear.
One thing, I think Dr. Bhadran said that I had to give my phone number. It is not necessary. All of us are, all of the home doctors are able to prescribe medicine in emergency conditions. So my idea is to prescribe all doctors, all homeopaths, all doctors to prescribe such a condition. I remember one thing. My uncle, Dr. P.K. Isho, was the ex-director of homeopathy. When he had these symptoms of stroke, he asked his wife to give him aconite, then arnica. Before going to hospital, he took it and he survived. Actually, a very heavy clot was there, the brain, but he recovered completely by the treatment. So, but now it seems that some very good doctors are admitted in hospital with stroke and they get paralyzed or go to the coma stage or they die in the hospital. If they had taken aconite from their heart or arnica from their house, they will get a very good result. Now the hospital authorities are very strict to strict and avoiding strict to take homeopathy medicine. They won't allow. If we can give such medicine in the hospital, the patient can survive, but they're not allowed. But so before going to hospital, it has to be taken. So even in the homeopathic families, this aconite and arnica, some medicines are introduced to our family members. If we become a affected person, we cannot take the medicine that time. Even think that name of that medicine. Yes. So our counterparts in family members should be aware of this, and that medicine should be kept in a very accessible area. That's my suggestion.
I am to suggest that I didn't suggest Abraham Vaidyan's name to be included in whatever, whoever be the available doctor, the person, they can contact any good homeopath and use the medicine accordingly.
Okay, thank you, Vaidyan sir. And now I invite Dr. Sridhara Kurup, who raised hand first. Okay. Sridhara Kurup sir. You can unmute from your side, sir.
Yeah. It's muted.
You unmute from your side, sir. Sridhara Kurup sir.
I think there is an issue.
Dr. Shaji, could you add? Please,
yes.
If Dr. Prasad Chandran or Dr. Shibu Charian, who are my pioneers, they are present in the platform, please call them.
Hello, you can hear?
Yes, sir. Yes.
Yes. First of all, my hearty congratulations to Dr. Abraham Vaidyan making such a good presentation. Was very nice. Second, I like to tell him appreciate this idea that giving a kit. But I like to tell, don't give to the name of to the medicines there 1, 2, 3 like that, or make a.
I think the host muted unknowingly. Somebody muted everyone. So, okay, please unmute from your side again, sir. Sridhara Kurup sir.
Yes. Now you can hear?
Yes, yes.
Then I tried this. Then the patients started taking themselves and they entered in the Google and then they started taking themselves and studying about the medicine. So it is better to give that code number 1, 2, 3 like that. Example, aconite number 1 A, arsenic number 1 B, like that code number, and then they will ask your phone number also must have to give. This way only it is better. Otherwise, the patients will start themselves to take the medicine, and I lost so many cases like that. Now I will give only 1, 2, 3, 4, 5, 6, 7, 8, 9 like that of medicine. I may give, but they cannot take. They don't know what is the medicine. So immediately they will give a call, and they will take. I will advise them to take number 1 or 2 or 3 or 4 like that. That is the better idea. What I feel. Then another thing I like to ask Dr. Abraham Vaidhyan regarding his experience regarding the snake poison. I am also interested in snake poison. That is why I am asking. But except that this Echinacea mother tincture and some other medicine he mentioned, I like to know about the effect of the cedron, and that this Apis mellifica, etc., are our best remedies. What about his experience within that? Because he is an experienced person in poison treating. That is why I like to know. Anyway, thank you very much for me giving an opportunity and having such a very good ideas and gave a very good presentation. Thank you very much. I like to hear from Dr. Abraham.
Welcome, Dr. Sridharakum, sir. Regarding my experience in snake bites, there within a year I had attended 538 cases, snake bite cases. I think most of them are non-poisonous or having little poison, but more than 20 cases are very poisonous, and they came in a very severe condition. Among them, I had to mention some 3 or 4 cases of cobra bites. The one person at that time we used to give Echinacea tincture 2 drops in a 5 ml distilled water and give injection and give the medicine through mouth. That was the practice at that time. But I discussed this case with our the TP Elias, was a great scientist in homeopathy, the principal of Kottayam College. He suggested that injection is not necessary. You just give through the oral only. If the patient is conscious, give it oral. Or if it is necessary, don't give that injection. You can give it to other media. So then our practice was to take 5 ml of Echinacea tincture and mix it with 100 milli of water and give 1 spoonful every 5 or 10 minutes. We give like that. If the patient relieved from his poisonous effect, he will refuse to drink that medicine. That is the thing what observed us. If the condition is so severe, I took the book, toxicology book, Modi's toxicology book with me. In some cases, I referred the book. I find that the patient is in the last stage, unable to breathe. There's no pain in side. At that time, we gave many injections. He's not having pain in that injection. So his nervous breakdown was, he is unable to breathe. And the saliva with the yellow colored saliva dribbling out from the mouth. And we think that's the last sign of snake poison. At that time, while referring that toxicology text, I noted that the cobra is, the other name of cobra is Naja. Suddenly, I think about our Naja, and I took I look at the cupboard and I saw that Naja 200 is there. I just took and gave 1 or 2 drops in his lips. Suddenly, he started mourning. Before that, he was in a semi-conscious stage. Now he is able to mourn. Then he developed pain. Then his breath was normal. Within 30 to 45 minutes, he get up in the bed and asked to as the urine can to urinate. We gave it and he's urinated more than 1 liter of urine. He's having only 23 years of age. His name is just forgot his name. Name, and he's a married person. He's having 3 children. His wife and children are waiting outside the ward. But this result was very amazing. I don't know. I tried to collect Sidron, Hongnang, etc. for this, but I didn't get it. Actually, the Mugalepalli is the area. It was 60 kilometers away from Warangal district. In Warangal district, there is a homeopathy, there is medical store, homeopathic medical store. But such medicines are not available there. So I couldn't get it. Then due to the home atmosphere, my mother was so aged, I have to come back from that place within 1 hour, 1 year. That's why I couldn't use this Sidron, Hongnan, etc. I think one doctor, Jacob Thomas, is attending this meeting, and he was the first qualified person who worked in that field. He can answer more.
Yeah, Dr. Jacob Thomas, please raise your hand so that we can unmute you. Dr. Jacob Thomas, can you please raise your hand?
Sir, no such participant is there in the list.
Okay. Then I call Dr. Binduraj. You have something more to say, Dr. Abraham Vaidhyan?
Yes. And at that time, Naja, then we find that there's another doctor, Dr. Benshaju is with me. He's a very good expert to find medicines. He's an expert in repertory, etc. So we found that Naja is very specific for cobra bite.
What about lachesis?
Lachesis, according to symptoms we gave, first of all, with the Echinacea tincture, we will give aconite because the anxiety, etc. If the symptom source of lachesis, we give lachesis. Different medicines are giving according to their symptoms.
Okay.
While reading the Visha Ayurvedic Visha Chikilsa, I read the book that if the poison is strong and the medicine is not able to act fast as this poison, they asked to use mantra. This mantra has effect on poison, and that is sound waves antidote the poison. That's I read from this Vishagadi Chikilsa from Ayurvedic book. So like that, our potency act like mantra, and it antidote the effect there. I think so.
Thank you.
Okay.